Hello, I'm Dr. Jeff Hamdorf. I'm Professor of Medical Education with the University of Western Australia, and I'm also a surgeon. I joined the editorial advisory board of the Virtual Cancer Centre some 3 years ago now, and today I'd like to share with you some of my insights about weight loss surgery. You would probably be aware that the health problems caused by excessive weight have been increasing in the Western world, particularly over the last 2 decades or so. The health problems that we are talking about here include an increased risk of heart disease and high blood pressure, which can in turn cause stroke. Also, there's a very high risk of developing diabetes and other problems with breathing, such as sleep apnea and asthma, and some digestive disorders as well. Overweight people have problems with mobility, and they are at risk of developing diabetes, especially in the weight-bearing joints like the ankles and knees. Fertility is affected, especially in women. That means that the overweight are much less likely to be able to get pregnant. So obesity is regarded as morbid obesity when it reaches a point where there's a significant risk to health, and we can calculate an index for people called the body mass index, and this takes into account your weight and height. And really, we're talking about morbid obesity as people who have significant illnesses related to their weight, or who are in the order of 40 kilograms overweight. Obesity is a chronic illness, and it does require significant treatment. Now, the reasons for obesity are many. It's not simply a result of overeating. Once a patient becomes morbidly obese, a change in lifestyle, such as a calorie-controlled diet and increasing exercise, this is really important, but these have a limited effect on morbid obesity. Patients just really can't seem to lose enough weight using a diet approach alone to correct their health problems. So the principles of weight loss for people who are overweight, but perhaps not obese, include a supervised diet and exercise program, and this is entirely appropriate, and there are lots of these programs around. Unfortunately, these are not entirely suitable for the obese patients, and particularly morbidly obese patients, because in over 90% of cases, the weight lost in a supervised program is resumed within a couple of years. Once a patient's weight is classified in the obese category, then diet and lifestyle changes are not enough, and medications may need to be added. There are 2 major medications in this area. They include Reductil or sibutramine and Xenical or Orlistat. These medications have to be offered under medical supervision. Now, another method which is successful in obese patients is cognitive behavioural therapy. Now, this is group therapy supervised by a clinical psychologist, and it looks at the reasons behind people's troublesome eating habits. And this may be available in Australia through general practitioner initiated care plans, so a GP needs to organise it. For patients who have morbid obesity, that's people who are more than 40 kilograms overweight or who have health problems created by or made worse by their weight, then surgery is the mainstay of treatment. Surgical procedures are based on reducing the amount of food one is able to eat and before fullness occurs, and these are called reductive procedures, such as an old-fashioned gastric stapling, or more recently, a laparoscopic adjustable gastric band, or lap band. With laparoscopic banding, a silicone band is placed around the top part of the stomach, creating a small upper pouch. The band can be made tighter or looser, depending on the weight loss, and this operation is one which is almost always performed using the keyhole technique. The band can be adjusted and can be reversed if necessary. This is a method which helps people keep a sensible calorie-controlled diet, and if it is reversed, most patients will resume their weight rather quickly. Another method which is gaining some popularity is called a sleeve or a tube gastrectomy, where a part of the stomach is surgically removed so that one is able to eat less. Now, none of these methods tell patients what to eat, so we need to be fairly conscious about diet, and accordingly, for all surgical care of weight loss, a team approach is necessary, with advice for the patient from a physician, as well as a surgeon and a dietitian, and sometimes a psychiatrist or a psychologist as well. Some teams use an exercise physiologist or a specialist physiotherapist to help design supervised exercise programs according to patients' needs. More extensive surgery includes an operation which is particularly popular in the United States called a Roux-en-Y gastric bypass. Now, in this operation, the stomach is cut at the top portion, leaving a small pouch, and this is then connected to the intestine lower down, so that only small amounts of food may be eaten, and the small amounts of food that are eaten take some time before they get to the digestive part of the bowel. That means that if the patient eats the wrong sorts of food, then they will experience significant indigestion symptoms. In addition to this, they will require daily nutritional supplements such as vitamins and minerals. Surgery for weight loss is very successful in a patient who is well prepared and well motivated to succeed, and most patients can expect to lose up to 60% of their excess weight. We find that this helps correct the diabetes very quickly, patients sleep better and are much more mobile, than we've found that their quality of life improves significantly. Surgery is an important part in weight control, and it should only be considered where a multidisciplinary team approach is used to help supervise patient care. Thank you for your interest and have a great day.